AMRIC transmission-based precaution resource webinar this afternoon. My name is Josephine Galway and I'm the Director of Nursing on the AMRIC team, and we are delighted to be presenting one of the projects for the HSE system this afternoon. This webinar is being recorded and it will be available in the coming days up on the HPSE website. I'm delighted today to be presenting with Barbara Slevin, our Assistant Director of Nursing from the AMRIC team. And we're joined by this great working group that worked on this project for this presentation today and for the implementation of this project. So I'm joined by Breda O'Brien, who's the Assistant Director of Nursing of Infection Prevention and Control in our UL Hospitals Group. Michelle Hennebury, the Clinical Nurse Specialist for our HSE Carlow Kilkenny and Tipperary South, HSE Dublin, Dublin East. Geraldine Crowley, the ADON for the Midwest, and Patrice Bowe, who's Director of Infection Prevention and Control for the Charter Medical Private Hospital, who was formerly the Director of Nursing of our Children's Hospital Ireland. So you're all very welcome today to present on this webinar. Today we will cover items. The project will be introduced. There'll be a little bit of background into the transmission-based precautions, the project, and how it unfolded. Existing resources. We'll talk a little bit about the implementation of these resources across the system. So we'll have a standardized approach to transmission-based precautions in our services, so they're very familiar to people on the ground. Contact precautions, our droplet precautions, and airborne precautions. There's also some pediatric posters that will be discussed, our protective isolation resources, and of course there'll be questions and close. I'd also like to draw to your attention as well on the chat function on our webinar there. If you want to put in any queries or any questions, please do so, and we will endeavour to answer some of them on the webinar as we're going through that. The other piece around that is some queries have already come in relation to it, and they will be addressed on the presentation as well. I'd like to hand you over now to my colleague, Barbara Slevin, to move forward with the presentation. Thank you, Barbara.
Thanks, Josephine. So I'm going to talk to you this morning just about the background into the project, and just to share with you about how we went about setting up this project and developing these resources. So as Josephine mentioned, we set about to develop a standardized set of transmission-based precaution posters and resources for use across all healthcare settings. And with that was to develop a suite of materials to support their implementation as well. So standardization was really, really important to ensure that there was consistency in approaches across all healthcare facilities. And that was really important as well to ensure that the management of patients with transmissible infections was also consistent. And with that, it was important to bear in mind our service needs, our service users, and ensuring, that the patient was very central to everything that we do in terms of the development of these resources. And it's all very fine developing resources and having these available, but it's important to ensure that they're implemented on the ground. So part of what we're doing here with you today is signposting you to these resources and helping you to implement them on the ground as well, and to support that implementation. So we work very collaboratively and closely with our project management team and our communications team here in AMRIC, and they supported this project with us as well. So when we set about developing the foundation stones for this project, we looked at the existing resources that were there, and I'm going to share some of that information with you in a few minutes. We also set up a working group because it's important really to have representation across the different regions and different areas to support their implementation as well. And it's great to have the working group here joining us on this webinar today. So that working group comprised of infection control nurses across both acute and community settings across 2 different regions, and also representing the Children's Health Ireland. And you'll hear this consistently throughout this webinar, but standardization is really, really important. So we developed standardized resources for contact, droplet and airborne precautions, and also protective isolation signage. And part of that consistency and standardization was ensuring that we had standardized colours as well to match those types of precautions. And I'll talk to you a little bit about implementation shortly. So consistency and standardization, again, I'm going to keep saying that, but it really, really is important. And the cornerstone of everything we do really is very much aligning it to the National Clinical Guideline here. And you're all pretty familiar with it at this stage. But if you're not, this is the link to where you can find that resource on the Department of Health website. So everything that we did was very much aligned to the National Clinical Guideline. So as I mentioned, we reached out to you, the infection control nurses on the ground, to see what existing resources you were currently using in relation to transmission-based precautions. And we asked you to send us some examples of your resources. And in fact, we reviewed 104 of those poster resources that were sent to us from different areas. And from that, we ascertained that there was huge variance really around the type and content that were included in the transmission-based precaution signage across both the acute and community settings. So it really was important from us, from our perspective, and particularly now as we have transitioned to the health regions and moving towards integration. We know that our staff move consistently across our acute and our non-acute settings. So it was really important to ensure that those resources would be standardized across these different settings. And we developed a suite of resources as well to support their implementation as well. We also did some surveys, and we did some surveys with the areas from our working groups. And within those surveys, we asked some feedback from our infection control teams across those regions, and also from staff on the ground, because it's important to bear in mind our end users, who are our frontline staff, who are going to be using these resources on a daily basis. So just some quick feedback. There was a lot of feedback to take on board, but I think just some of the highlights here was asking people, was English their first language? Because we understand, that we have a very diverse workforce now. And actually, almost 30% of our respondents said that no, English wasn't their first language. So based on that, that was really important in terms of visuals and images and color coding, because that can be the trigger to help support people to understand what precautions are needed based on the type of color coding and images that are used as well. And just a quick snapshot here, but I think one of the things that I took home from that survey was the use of a point of care risk assessment. So I think everybody at this stage is very familiar with PCRA and point of care risk assessment, but perhaps maybe not in the context of transmission-based precautions. It may be used more commonly as an assessment piece. So it's very important to kind of bear that in mind in terms of how that was woven in through the development of these resources as well. So that was just one of the take-home messages. And as well as that, some of the PPE that's used for different precautions here, there was a huge variance as well when looking at those survey results. So as I said, there's no point in having these lovely shiny new posters sitting on a shelf anywhere. It's important that they're implemented. So at this stage, we work very closely with our designers, and we have designed and developed and printed these resources, and these have been disseminated across the HSE areas to date. As well as that, what we're doing here today is to try and signpost you to those resources as well to support the implementation on the ground. And what we're doing here as well is communicating it with all of our stakeholders as well. So obviously today on the webinar, and we will be linking closely with our infection control colleagues as well on the IPCN forum in December. And as well as that, just signposting people to the resources on different platforms, for example, our Resist newsletter that you all receive on a quarterly basis. And the implementation is important, but it's not only about the implementation, it's about evaluating how they have been implemented on the ground. So in about a year's time, we're going to go back and see how everybody's getting on with these resources and if they have been used in your areas as well. So we'll be doing some audits and looking at some feedback at that stage. And just finally, just to signpost you to where these are published as well. So this is the HPSC website here. And as you can see, our poster resources are all housed on this website, but each of the transmission-based precaution posters, both in adult and pediatric versions, are posted here on this website. And in that link, there is also a link to the HSE website where all the explainer documentation to support the implementation of these posters are housed. So without further ado now, I'm going to hand you over to my colleague here, Breathe O'Brien. Thank you very much for your time.
Lovely. Thank you, Barbara. So hello, everybody. So my name is Breda and I'm delighted to be with you this afternoon. So I work in the HSE Midwest Acute Services down here in Limerick. So I suppose firstly, I am aware and I really want to acknowledge that the concept of contact precautions is not new to anyone on this call today. So I'll get you to move to the next slide, Barbara. So I suppose the main thing really is the layouts of your current posters will now change somewhat. But ultimately, I think it will help all our sites. So regardless of our setting, so we'll all align with a consistent, standardized approach to the messaging that is contact precautions. So next up, then you'll see that standard precautions will continue to work with contact precautions. So nothing changes in that regard. So now I'm going to introduce you to the poster. So it will be yellow in colour, so the same for some of your sites and not for others, but standard precautions or contact precautions is the poster that's going to stay the same for us here across UHL. So the design process for this poster really followed the promotion of the 3 key pivot points that form the basis of contact precautions. So we have hand hygiene and then the appropriate selection of our PPE, which is now and always should be guided by our point of care risk assessment. So with regard to our visitors then, we have included them. So we have one simple message but an effective message, a prompt, asking them to come to us as healthcare workers for guidance on what PPE they need to wear, if any at all. So next up, you'll see that the patient is central to all we do. And I suppose amidst all the aprons, all the gowns, all the gloves, we must remember, I suppose, always the importance of bringing the patient on the journey with us. You know, talking to them, explaining to them why contact precautions are in place. And then we have available to us all the information leaflets and then accessing surveillance systems if they are available within your area of work. So hand hygiene, what can I say? Only it must feature, as it remains the common denominator across all our posters being discussed today. So then gloves. So I suppose we acknowledge that gloves need a special mention. So I don't know about you, but I can say from my clinical practice, I would say that glove use went somewhat out of control since our COVID days. So we have a job to break that cycle where staff associate contact precautions with gloves. So I'm sure you'll agree with me that the main message of all our training is to, giving staff the confidence to stop and think, do I need those gloves? Will I have an anticipated exposure to blood or body fluids? And then the last element on the standard precautions poster, you'll see it there on the right-hand side. It relates to apron or gown selection. So we have married this element to the point of care risk assessment. So we're giving staff the confidence to appropriately risk assess and wear the most appropriate piece for the task that is to be undertaken. So the QR code will bring staff to the explainer on each of the posters. So once again, that will give, I suppose, greater detail to staff on each of those elements on that poster. So that's it from me. So now I will hand you over to Michelle, who's going to introduce the droplet precautions poster. So thank you.
Thank you, Rita. Good afternoon to everybody. My name is Michelle Hennebury and I'm a clinical nurse specialist in IPC within HSE Dublin and South East. So I've been working within IPC for over 10 years. So as you can all relate, we can appreciate the importance of having correct signage to signal to staff when transmission-based precautions are required. So I am going to focus on droplet precautions today. So if you wouldn't mind going to the next slide, please, Barbara. So the droplet precautions poster itself, the purpose would be to prevent transmission of respiratory infections, which is very important at the moment, especially when we see an increase in influenza. So as we all are aware, droplet precautions are required for influenza, pertussis, COVID-19, for example. And the main reason for these posters are to protect our patients, our staff and our visitors. Also, it reinforces the addition of droplet transmission-based precautions for all staff through the utilisation of a visual aid. And it helps to create a standardised, nationally recognised colour-themed poster, which will provide continuity within our facilities. So we can see on the next slide that we have now changed to the colour blue. So some people might be wondering, how were these colours picked? So the colour blue was chosen in line with the Australian colour theme for droplet precautions. And this is in alignment with the National Clinical Guideline number 30, Infection Prevention and Control 2023. So I suppose it's important to note, I'm from the Southeast and blue is what we would have used for droplet. But as in many areas, the other precautions colours will be changing. So it is a case of having to adapt and to learn and to implement this safely within our facilities. The colour may be of change for some areas across Ireland, therefore highlighting the need for the provision of education when implementing the posters within your facilities. The visual is simple and it includes key points. So rather than the addition of excess writing where key information will be lost, a QR code has been added to the bottom right of the poster, which will bring people to an explainer, which provides additional support regarding what is required from a patient placement and PPE perspective. Also, you can find a link on the HPSC website, which will bring you to an explainer which can be printed off. There is also reference to additional posters which can be utilised to support the implementation of droplet precautions, and these will be the point of care risk assessment, which Rita explained, respirator masks poster and the gloves off poster. So on the next slide then, it was decided to include a droplet specific paediatrics poster also, which includes the same key information but has softer infographics. As you can see, the visual includes a child-friendly image. The paediatric posters will be discussed in greater detail by Patrice. On the next slide then. We will just go through the droplet precautions explainer. So I know Breda has touched on these points already. So just to show you, the key points would be patient placement. So preferably in a single room with a dedicated toilet en suite, and the door should remain closed, but please consider safety risks. A risk assessment may be required. And obviously we are aware that not every facility would have a single room available. So again, a risk assessment would be required, and this will be explained further in the presentation. So the explainer itself is divided into 2 steps. So step 1 will be assessment of the patient situation and complete a point of care risk assessment. So before each patient interaction, a healthcare worker must assess the patient situation and complete the point of care risk assessment. This must occur before every patient interaction to ensure healthcare workers accurately assess the need for what PPE is appropriate at that given time. It also encompasses consideration of patient placement and occupational aspects such as vaccination status. And as we're all aware, most staff do this, but they might not relate to the terminology PCRA. But again, it's just to be cognizant of the fact that most people should have access to a point of care risk assessment and be educated on it, because it is very, very important. Because historically, when we worked in infection control, we might have said you have to wear this when you're going into a patient with a certain infection. But learning through COVID has identified that now we need to base it on the patient that we're dealing with at that moment in time, and so many different points which are available to us in the point of care risk assessment in relation to the patient. And you know, what are their symptoms? Are they mobile? Are they not mobile? And again, it's all about the importance of a risk assessment. Then on the next slide, we just break it down into the patient. So step 1 also references the patient, tasks and the environment. So please remember, this is a supporting tool and risk assessments are likely to vary from person to person. So with the patient, we have to consider, and again, we're probably all doing this anyway, but it's just to point it out. Has the patient respiratory symptoms or recent contact with a person who has a known or suspected respiratory illness, such as a known or suspected pertussis, seasonal respiratory viral infection, such as RSV, influenza, COVID-19, meningococcal infection? This is applicable for the first 24 hours after beginning effective treatment. MERS-CoV or mumps. Is the patient identified as a potential risk of infection, for example, respiratory symptoms, rash, suspected bacterial meningococcal infection or recent travel? Has the patient a known history of carriage infection with multi-drug resistant organisms or MDROs? And again, you might ask, why is this relevant if someone is requiring droplet precautions? But again, you have to look at the patient as a whole. Is the patient mobile, ambulatory, independent, and are they capable and willing to perform hand hygiene and respiratory hygiene? Consider safety risks. Risk assess the patient placement in a single room. And again, it's just to highlight the importance of checking our surveillance systems. And again, every area may have different systems and may have access to different systems. Again, if it's a chart, lab results, recent swab screens through your lab systems or ICNet. And then onto the next slide, we just touch on the importance of considering our tasks. So consider, what type of task am I about to perform? Is this a non-clinical interaction or is it a clinical interaction? Am I about to perform a task such as providing personal care, assisting with respiratory support procedures, bathing, toileting, etc.? Again, you need to consider if it is a high contact or a low level contact or with prolonged contact. And will the task increase the likelihood that my skin clothing will become contaminated? So again, this will help direct the staff whether they need to wear a gown or an apron. And then finally, the environment. So again, it's important, just on the next slide there, please, Barbara. Just with the environment, consider, is the person located in a single room? It is recommended for droplet precautions that a single room is used if available. If the patient becomes symptomatic while in a multi-bedded room, move them to a single room and assess other patients in that area. And again, it's always very important to follow up-to-date national guidance in relation to the infection that may be circulating at that time. Monitor these patients for development of symptoms, and risk assess, is there a risk to others from other individuals, for example, shared rooms, mobile patients with infectious symptoms, and consider cohorting where appropriate. Think about equipment. Is there dedicated equipment for the patient? Consider your blood pressure monitor, BP cuff, thermometer, high sling. Also, is the equipment shared? For example, a commode, hoist, blood glucose monitor, blood pressure monitor. If yes, clean and disinfect reusable equipment between each use. And again, it's really, really important to highlight to staff that they're utilising the correct products. In some situations, we've noted in the community that staff were utilising detergent wipes, assuming that they were combined. So again, there is a little bit of confusion in relation to products. Consider space for physical distancing items of equipment. And then on to step 2 of the actual explainer. So choose appropriate PPE and implement the required actions in line with standard precautions, including the following. So again, it's really, really important to ensure that the droplet precautions are in addition to standard precautions. So clean your hands in line with the WHO 5 moments. Ensure access to hand hygiene products, facilities, and select as appropriate. So whether it's going to be alcohol hand rub or hand washing. A surgical mask, then this was required for droplet precautions. Risk assess requirement for FFP2 respirator, for example, if you are undertaking an aerosol generating procedure. And again, follow procedure for fit checking as on the poster. And equally, it's very, very important to follow, again, national guidance in relation to a particular infection. Eye protection, risk assess using the point of care risk assessment. Gloves, risk assess glove requirement, consider in relation to tasks such as contact with chemicals or if there is a risk of blood body fluid exposure. For example, urine, vomit, fecal matter, respiratory secretions, etc. Your apron and your gown, you need to consider whether there will be a low contact interaction with the patient, which may dictate an apron, or if it is high contact interaction with the patient, it may dictate a gown. And then the importance of disposal of PPE. So you dispose of it inside the patient's room and risk assess the disposal into healthcare risk waste or non-risk waste streams. And again, this is very, very important. And especially as we move towards sustainability and reducing PPE usage, we need to ensure that the PPE that is being utilised is disposed of in the correct stream. Removal of surgical mask outside the patient's room and clean your hands. And then my final slide will be additional key information. So again, this is all included in the explainer. So reassessment of PPE requirements should occur as the clinical scenario develops to reflect changes in transmission risk. Visitors do not routinely need to wear PPE, as Breathe reiterated. They should be encouraged to clean their hands before and after visiting the patient, advise and support visitors regarding PPE as appropriate, and visitors should not visit if they have any acute onset of respiratory or GI symptoms. As well, it's really important to note that when a patient is finished transmission-based precautions, that the posters are removed, because again, it would only add to confusion and it may lead to someone being isolated for a longer length of time, which isn't necessarily required. So I just want to thank everybody for their time. And now I'll hand you over to Geraldine, who is going to discuss airborne precautions. Thank you.
Thanks very much, Michelle. Good afternoon, everybody. My name is Geraldine Crowley. I work here in the Midwest in the community covering Limerick, Clare and North Tipperary. So I'm going to talk you through the poster on the airborne precaution. As you can see, the format and the style is the same. So airborne precautions, they're used for patients who are known or suspected to be infected with microorganisms transmitted from person to person by the airborne route. So Michelle spoke about the droplet route, we just spoke about contact, so I'm going to talk about the airborne route. And for microorganisms transmitted by droplet when aerosol generating procedures associated with an increased risk of infection are performed. So again, the colour of the poster might be something different to what you're used to. So it's a nice orange, like the Resist orange. But as stated previously by all the previous speakers, the purpose of these posters is to standardise and guide practice across all our regional health areas. Thanks, Barbara. The next slide. So again, before we start any task or procedure, a point of care risk assessment should be carried out before each patient interaction. And as Barbara mentioned that previously, and Michelle and Breda, and it's really an integral part of standard practice, and it should be performed by every health and care worker before every patient interaction. So it's to allow them to accurately assess the risk of exposing themselves or others to infectious diseases or transmissible microorganisms. And it does support the selection of appropriate actions in PPE, in addition to any IPC recommendations already in place. So it does guide all our practice. And as Michelle alluded to as well previously, previously you might have, with the poster said, put on your PPE and you go. So really, this point of care risk assessment is so important before every patient interaction, because it does guide on what we need. And Michelle mentioned sustainability as well, and that's really important for all of us going forward, I think, with all the amount of PPE that we use as well. Okay, the next slide, please, Barbara. So, like Michelle, in the explainer, we have two main steps. Step 1 covers 3 things. It covers the patient, the task, and the environment. So again, similar to the other previous 2 posters, the steps to consider. So in relation to the patient, has the patient recently had symptoms or contact with a symptomatic person with respiratory symptoms? In this case, I suppose you're looking for things that are transmitted via the airborne route. So again, have they recent contact with somebody with pulmonary TB, with measles, or with chickenpox? Are they identified as a potential risk of infection? Have they respiratory symptoms? Again, have they a rash, which could be indicative of the measles, or a history of recent travel? Have they known multi-drug resistant organisms? Again, if you have access to ICNet or iLab, you can check on that. Or as Michelle alluded as well, if they've had any recent swabs or screens, or you've access to their notes. Again, are they mobile, independent? Are they capable of performing hand hygiene and respiratory hygiene? Because that's really important for all our patients as well. And then in relation to a single room placement risk assess. So it is obviously recommended for anybody on airborne precautions that they're placed in a single room with the door closed. This isn't always possible, and certainly we know in a lot of our community nursing units we mightn't have actually access to a single room. But again, I'll refer you to a document, the guide to prioritisation of patients for single room isolation when there are not sufficient single rooms for all patients that require isolation. And that was published in August of this year. So that's a good guide to have as well, if you need it as well, to guide prioritisation for single rooms, but recommended that patients on airborne, that would be the main recommendation, that they do have a single room with controlled ventilation. So then in relation to the task, we have to consider if it's a clinical or a non-clinical. So again, what are you going into the room? Are you going in to drop a tray maybe? Are you going in to give the patient their medications? Or is it going to be clinical? Are you going to be up close and personal, providing personal care? So again, you talk about the low and the high contact tasks as well. So again, low contact is an apron sufficient then, because you're not going to have much contact with your patient. Again, the high contact, up close and personal with your patient for prolonged periods. And then in relation to the environment, again, it's the person located in a single room. Again, it's recommended, as I said, for airborne precautions, that a single room with controlled ventilation or negative pressure room. Again, we don't have these in our community nursing units here in the Midwest again. So a single room with ensuite facilities would be recommended. Again, if they are sharing, again, you'd be monitoring the patients in the room with them as well and risk assessing them. And then again, in relation to equipment, is there dedicated equipment for the patient? So again, in relation to your Dynamath and your hoist sling, your commode, preferably dedicated, but if not, you mightn't have enough equipment. Just make sure that there's a process in place for cleaning and disinfection of that equipment after every use. And in the second step then, in the explainer, we talk about the appropriate PPE and implementing the required actions in line with standard precautions, including the following. And as always, as Breda mentioned again, is your hand hygiene. So clean your hands in line with the WHO 5 moments and ensure you have access to hand hygiene products. Again, one of the things you would have seen with the outbreaks is that staff who carry their toggles, then they have PPE on and they're trying to get access to that. So make sure you have access to PPE at the point of care, whether that's your alcohol hand rub or clinical wash hand basin. In relation to your masks, so an FFP2 or 3 mask is required for airborne precautions. So as Michelle mentioned, for your standard or for your droplet precautions, surgical mask, and then depending on the task, if you are doing aerosol generating procedures, FFP2 or 3 is recommended for airborne precautions. In relation to fit testing, so the Health and Safety Authority do recommend that staff have access to fit testing if at all practical. And again, I'll refer back to our PPE guidance document, infection prevention and control recommendations for the use of PPE. That's version 3, the 21st of the 8th, 2024. So again, if you can't have access to fit testing, it's recommended that those at the greatest risk, because they mention endotracheal intubation again, would be obviously one of the higher risks. But if not, every time a health and care worker use FFP2 or 3 mask, we need to ensure that we do a fit check. And that's a really good guide there, that poster, the safe use of FFP2 respirator mask. So it's really important that every staff member, whether you're a healthcare assistant or a nurse or you're a doctor, whatever, that you are familiar with doing your own fit check, because that's our responsibility as healthcare workers. So that's really, really important. Then in relation to eye protection, so eye protection is required again for airborne precautions. Again, for droplet, it depends on the task. It is required for airborne precautions, so goggles are needed. And then gloves, and Breda spoke about gloves. Again, before you might have just put on a pair of gloves routinely. So you need to risk assess the need for gloves. Do you anticipate any contact with blood or body fluids? And if you don't, why are you putting on a pair of gloves? So that needs to be considered, and that's a really good guide as well, that gloves off poster that Breda alluded to there. And then in relation to your apron or gown, this is where you consider again, is it going to be a low contact task or clinical task, or a gown high contact? So again, that's in relation to that. And then all the PPE should be disposed of in the room except for your mask. So again, everything's taken off. Remember, gloves always last on and first off, your hand hygiene in between. So again, please adhere to the donning and doffing posters as well. So everything comes off except your mask in the room, and then you leave the room and then you'd remove your mask. And again, you can see the infographics are the same on this poster as well on the right hand side there. Thanks, Barbara. The next slide, please. So again, visitors, we have mentioned visitors on the poster. Again, they should always check with staff before entering. They shouldn't be visiting really if they have acute onset of respiratory or GI symptoms. And they don't routinely need to wear PPE, but they should always check. I mean, there might be a need for a visit, so they always need to check with staff. And again, as Michelle mentioned, reassessment of PPE requirements should occur as the clinical scenario develops to reflect changes in the transmission risk. Again, there's more guidance on this on our own NCEC Volume 1, Section 3, number 3.2.4, page 98 to 101. Thank you. Now I'm going to hand you over to Patrice. Thank you.
Thanks, Geraldine. Good afternoon, everyone. My name is Patrice Bowe, very recently appointed as Director of Infection Prevention and Control here at Charter Medical Private Hospital after almost 25 years in Children's Health Ireland. So when I joined the subgroup, I was working as the Director of Nursing in Infection Prevention Control in CHI across all the sites in CHI. So I was absolutely delighted at the idea of having standardised posters in from a paediatric point of view. And I was delighted to be part of the subgroup working on these posters. So thanks to Barbara, Emer and the team for inviting me on board and for your hard work facilitating the numerous meetings and pulling all the information together and feedback. So thank you for that. I'm equally excited about the prospects of having these posters from a national perspective, regardless of where we're working. It'd be, whether we're permanent staff, agency staff, it would be amazing to have a standardised approach. I think everyone agreed to the isolation posters, and I'm really looking forward to implementing them here on site. The paediatric version is what I'm going to talk about this afternoon, and the protective isolation posters. So if you don't mind moving to the next slide, please, Barbara. So the paediatric version, so my colleagues, Breda, Michelle and Geraldine have already talked about the posters, and the paediatric versions are based on the same principles depicted on the adult posters. And the images were used and designed to be paediatric friendly and in mind using them in any paediatric healthcare facility. And again, that's going to look different for each of us, so we appreciate that. So my colleague Brita has already covered the contact precautions posters, and again the paediatric version is exactly the same. Michelle covered the droplet posters and shared the paediatric version, and the airborne, Geraldine has discussed the airborne posters. So I'm just going to discuss and again, just to show you the pediatric versions, I'm going to discuss the protective isolation poster in the pediatric version for the moment, and the pediatric and the adult are exactly the same, and we'll put them side by side in a second so that you can review them. If you don't mind moving on, please, to the next slide. So as each of my colleagues have already discussed, all of the posters identify the importance of hand hygiene. So always hand hygiene, and in line with the 5 moments from WHO. If you don't mind moving on to the next slide, please. For protective isolation, as already outlined, the point of care risk assessment is what we use. So the very same as all of the other posters. It's how we determine what PPE we're going to require. So whether a surgical mask is required, gloves are required, that's our point of care risk assessment. That'll be the same as for all the posters. If you don't mind moving on to the next slide, please. Thank you. For protective isolation, it is optimal that the door is closed. But as always, you need to require and consider the safety needs of your patient and the individual needs of your patients. If you don't mind moving on, please. So we do a risk assessment to determine whether it's low or high contact, and that's already been discussed, and that will determine the PPE that you required. The next slide, please. So protective isolation would have been referred to as reverse barrier nursing. And the idea of this was they were developed to support current practices in your area for your specific cohort of patients. So again, we appreciate that these posters are going to mean something differently or used slightly differently in each of your clinical areas or in the community settings, but that's absolutely fine. They're there to support those practices. If you just don't mind moving on another bit, please. So we've compared, just to put them side by side so that you can see the principles are exactly the same. The pediatric version is just a little bit more pediatric friendly. And just the next slide, please, Barbara. Okay, so again, as previously discussed, the barcode on the poster can be used to access the protective isolations precautions explainers. Prompt for this poster. So in this case, the posters are white. So both the adult and the pediatric versions are based on a white background. The patient placement, single room, as we discussed previously, is preferable with an ensuite or a dedicated toilet, and the door is kept closed. But again, you need to risk assess and determine your own patient's vulnerabilities and requirements. So step 1, risk assess using your PCRA before every patient interaction. We need to consider the patient that you're caring for and their specific needs. 2, the tasks or the task that you're about to perform. 3, the environment. And step 2, choose the appropriate PPE and implement the required actions in line with standard precautions. So this is the explainer, like I say, that you scan from the barcode, and this information then is available for you to proceed. Next slide, please, Barbara. I think that's back to you, Barbara. Thanks, everybody.
So thanks very much to all the members of our working group who have presented on each of the posters today. And I'd just like to acknowledge Olivia Doyle, who was unable to join our webinar today, who was also a member of the working group. So I'm conscious that we have had a number of questions in relation to the use of the posters. So one of the questions actually was in relation to whether they're mandatory and are they to be used across all settings. So while they're not mandatory, we would recommend that the posters are used. And I think you've got a flavour of that from the webinar today about having a consistent and a standardised approach to the application of transmission-based precautions, very much aligning with the National Clinical Guideline and ensuring that consistency really across all healthcare services. So it is important, I think, to be able to support staff on the ground with consistent messaging in terms of transmission-based precautions. So whilst not mandatory, it is recommended. Another question that we received recently was, could we use the resources on the posters, but use them in relation to colours that they would have previously used in some of their areas? So again, I think you got the flavour of that really we want consistency across the board and making sure that there isn't really variance around the types of posters that are used in different areas. So we would advocate really that people are using them as they have been developed and designed. And that's why we really reached out to people on the ground and as well as that the frontline staff. And that was important as well around colour coding and ensuring that it was consistent. So it is really a change piece. It is a big change, and we recognise that that can be a big change for areas. So that is why we've developed these resources and those explainer documents to help and guide and support you with their implementation at a frontline level. So I'm just going to check in with Josephine and Emer, my colleagues, to see if there is any other questions there that we need to address on the webinar.
Thanks, Barbara. That was a great webinar, and I think you've covered most of what was asked really, and we've been answering some of them there on the chat. One of the things is people are looking to where to order more posters, so we'll certainly send that link out after the webinar, and you'll have how to order them from that. And the other piece is around, one or two people asked for landscape posters, but I think you had already established that, Barbara, while you were going through the working groups. You want to acknowledge that?
Yes, when we were developing the posters, we did explore the types and the formats and the sizing, and the vast majority of places use a portrait style frame, or in relation to space as well in their areas. So they were designed with that in mind. Okay.
That's great. Thanks, Barbara. I think everything else is more or less covered off. So thank you, everybody, for a great webinar today, and I hope you've got a lot out of it. You know where to reach us at our email HCAI account email address, or you can email any of us at Barbara Slevin or Emer O'Donovan or myself, Josephine Galway, in relation to any queries you have going forward. And thank you very much for your time today, and hope you will get to implement them and they will be of use to you in your services. Thank you very much. Thank you.